Start out. Okay.
And I think it's a good opportunity to share my knowledge with the lead health professionals because I feel that this is a time that we need to realize. So we need to realize the importance of emerging role of artificial intelligence, especially in health professions education. And it is my experience that in Pakistan, majority of the education system, they function on need base. If we take the example of COVID-19 period, the world was before COVID, the world was using blended learning and online medium for education, but we were not following that. And when COVID came and suddenly the institutes were shut down.
जरा सा आप आगे हो जाएं माइक के ताकि आवाज ठीक आए वॉल्यूम कम है
Dr. Hira, please, your voice is vibrating and some are not listening you and hearing you. Can you move your slides because your slides are also not moving, only fixed on the first slide.
I haven't moved the slides. I'm just using my topic to you.
Thank you so much.
Yeah, it's okay. I hope my voice is clear now.
Clear.
Okay, thank you so much. So I was emphasizing the importance of today's session because it is quite similar with the COVID-19 period when we jumped or switched to the online system mode of education, and we were not having any other option. So that's why we switched to, but the world was using it as an opportunity to facilitate the students for their learning, and we were using it for like second option or the option when we don't have other options. So therefore, it is the high time that we understand what artificial intelligence is and how the world is moving around it. So in today's session, we are going to explore the emerging role of artificial intelligence in general education, and then we will look into the role of AI as a call to action, and then we will discuss the implications of artificial intelligence in health professions education. So first of all, it is very important to understand that what is artificial intelligence, and if we look it from a broader perspective, it is a computer program or a machine that has the ability to mimic the cognitive functions, and those cognitive functions are related to the human capacity to think, to communicate, to reason, and to solve a problem and to reach a decision. So these are the abilities we generally associate with humans, and but now the machines and the computer programs, they are strong enough that they are performing such activities with a high precision that it becomes difficult for the humans to distinguish that either the task has been performed by the machine or by the human. So it is basically a computer program, and how it functions, it operates with the help of algorithms. And what are the algorithms? Algorithms are the instructions and rules that are, or you can say the computer language that is designed and developed and fed into a computer or a machine, and it follows the rules and generate an output. So whenever a new data is arrived or is given to the machine in maybe in the form of a question, like write a note on artificial intelligence. Yes, we can say that we can give this task to the machine and we can say, write a note on artificial intelligence. So the machine will receive the data or the question and it will run the algorithms. So it will extract the information that is already available to it, and it will perform certain tasks, and then it will generate an outputs. This is a very simple explanation of what is artificial intelligence and how it functions. So this functioning becomes very, very complex and higher when we move on the higher machines and or especially the robots. So it becomes very difficult and complex. So based on this function, we can classify the artificial intelligence in 3 types. And I would say this is not a new thing in our life. We all have been using our phones, and those who are using iPhone, they would be very familiar with the Siri, the system in the iPhone. It can help to make the phone calls, to organize your data, or it can help you whenever you need her. So this is the example of narrow intelligence. So it means that the intelligence is there. We are using it in our daily life, but when we become familiar with the technology, it comes on a ground level, and we become very comfortable with that. Even we don't realize that we are interacting with an intelligent system. So when we type on Google, so you can see the Google can read your intentions. It seems that Google can read our intention because what I supposed to write, Google can give you the options. So, and we can choose, mostly I used to choose the option I need, and it comes, sometimes it comes on the top and sometimes it comes on the 3rd or 4th level. So this is an example that the Google system is intelligent. Why it is intelligent? Because it is assuming and predicting that what we are going to search. And we have experienced that if I am working on an artificial intelligence research, so mostly the reminders or the highlights that are sent to me through my email or in my other softwares, or the ads I receive, they are similar or related to my research area. Once a time I was working on resilience, and I was receiving the information on resilience. And nowadays I'm working on artificial intelligence, and now I am receiving the artificial intelligence content on my social media accounts. So how I receive that? It is actually the artificial intelligence. The system is so intelligent. The system is picking up my trend of working on my social media accounts, or working on my email, or through the Google account. So it is taking the information, and it makes the prediction, and sometimes it is very helpful for me. So what content I need, it is there for me. So this is an example of narrow intelligence. And then comes the general intelligence. So it is a higher level of general intelligence, and it comes with the function of machine learning. And now it is a very surprising thing, like, do machine learns? Yes, it is possible. And how the machine learns? Because it is connected with the data. The machine is receiving, you can see there are games that are played online. There are the softwares that are used online. So when they are used online, your data is not safe. Your data is being monitored by the software, the machines, or by the websites. They are monitoring your data. They are taking your data. This is the reason when a new software comes, it is free to use, because they need the data to upgrade the system, upgrade the software. So the general intelligence works on machine learning. When they are using our data, they are learning from the data. So the very best example, and that is very common in today's discussion among the educators, is the ChatGPT. So ChatGPT is a software that can write essays. So that can write an article. You can give an example. You can say, plan a trip of Turkey for me. So he will plan all the trip. It will ask some question, and it will plan your trip. Like, you need to, these are the good agencies, you can contact them. These are the good hotels in nowadays. This area would be rushy and this area would be free, and you can go there. So these softwares are being used in every area of life. So this is a general intelligence. And here comes the curiosity. And more than the curiosity, you can say the worry of the world that the machine is learning and machine is taking decisions. It is solving the problem, it's making the decisions. So it is an alarming thing for us, because if the machine can decide, so why we need humans who can have the chance to make an error, and machine will do that quite precisely. And maybe the human is prone to become tired and machine will not. We just need to charge it. So this is the worry, because it is the level of function of the machine that is making humans worry. And then the third one is the super intelligence, and it is the main area of on which the leads of world, they are thinking about. We should stop it, and we should work on regulations, how we can pursue with super intelligence. And the reason is that the super intelligence, the system is having a neural network, and this neural network is just similar like human network, human brain, and it operates on the same ability, and it has the deep learning capacity as well. So super intelligence is a real worry for the world. And the leaders of the artificial intelligence and the leading countries like Japan, America, and China, they are thinking about, and they are talking to stop the super intelligence research, and first make the regulations that it will be fruitful or it will be beneficial for the humanity, and not threaten the human existence. So this was a brief introduction of the types of artificial intelligence, and being the health educator, our concern is the general intelligence, because it has quietly entered in our classrooms. Most of the educators, they are not aware. When they give the assignment to the students, they are going to the ChatGPT, or they are using the softwares. They are making the assignments and submitting to their professors. So the ChatGPT can write theses, ChatGPT can write articles. So it is an alarming thing. It has entered in our classrooms, and we need to discuss it. So the same worry is discussed by Ray Dalio. He is a billionaire of United States. He said that we are headed for a world where you are either going to be able to write algorithms or be replaced by algorithms. So as the algorithms are the core of artificial intelligence, so it is the worry among the individuals in every industry that we are going to be replaced by the machines or the computer programs. And I was listening to the news that the million of employees got unemployed because of the artificial intelligence. It has there in the offices, and it is performing the functions better than the humans. So it is an alarming, and it needs to be discussed and to make an informed decision. Now moving to towards the education, there are different systems that are being used in the education. The first and the most important is intelligent tutoring system. We might be not aware of that, but it is being used in the leading schools or in universities of the world, and its system has actually the interaction with the students, and it provides the individualized learning. It is kind of a module, and with the information and the subject content, then the interface where the student interact with the software. The software understands the learning capacity of the learner, and it generates the educational content as per the need of the students, and it provides real-time feedback that can help students to learn in a more effective way. And then it makes the assessment, and it submits the assessment that at which level the student is. So the intelligent tutoring system is being used in the world. Then the computer-assisted programs, I talked about chatbots and ChatGPT and Grammarly. These are very commonly used. Grammarly is a software that can detect the grammar in your paragraphs, and it gives the suggestions to improve the writing skills. So ChatGPT, I talked about it. It generates the information. So this all happens with the data. And initially, when ChatGPT was developed, it was free and it was freely available to the world. But now it has advanced to the level of 4th and 5th generation, and it is not that like free. It is now we can purchase it, but it is a very effective and can be helpful and can be threatening. Then the virtual reality simulations. I think we are familiar. We are using this virtual reality. I can remember my surgeon colleagues. They used to operate with the virtual reality simulations, and virtual reality simulation are being used in nursing skills lab. It is a very safe environment to teach students the basic skills that they cannot perform on the directly perform on the patients. And it is being used in the medicine and dentistry and and if we talk about other fields, it is being used in the aviation and other areas where the cost of performing direct procedure is high. We are using virtual reality simulations, and they provide the opportunity to the students to feel the reality in an artificial environment. So these are the most common commonly used artificial intelligence softwares in the education. And moving to the healthcare system, in Japan, in America, they are using robots. So healthcare system is moving towards the automation. Robots would be there to perform the basic functions, and they are there to support the health professionals because of the lack of manpower in the healthcare professional in healthcare system. The robots can assist them. So they are performing basic functions, and robots are taking care of the patients. They are feeding them. They are monitoring their health status, and they are communicating. Even the robots or the softwares, they are being used to diagnose the lung cancer, the brain cancer. So the things, the diagnosis that the group of professionals, they were before it, they used to sit together and decide the diagnosis. Now the computers and the artificial intelligence softwares, they are diagnosing it with a precision, and how they are diagnosing it with the high data available to them. So AI in healthcare is becoming part of it, and we are expecting that the future professionals, they will work with artificial intelligence in healthcare. So it will not be like the secondary thing, it will be a parallel thing. So leading to this, there was a question, like there is a question that is, if we can see what is going on, how artificial intelligence is affecting our medicine or the nursing. So do we think that it's a real call for us, or can we ignore it? Can we say that, no, we are not going to revise our curriculum. We are not going to pay attention to the ChatGPT. We are going to educate our students with the traditional method, because traditional method is more good. It's more reliable. We need to prepare humans. We need to develop soft skills. So we will ignore the artificial intelligence. So yes, okay, it's our choice. So would it be beneficial for the long run? Would it be effective to prepare the future professionals who are going to work with machines? So what capacities they would need? How the knowledge can be shared? So all these questions need answer. And for the answers, I think it's a call for health professionals, educators to come up and make research and make a valued contribution to reach an informed decision about the artificial intelligence in health professions education. So leading to this, as I said, that robots are in healthcare. So robots are working with patients. They are doing care more efficiently than humans. and people are appreciating it. And then healthcare is moving towards automation, and the future professionals will collaborate with artificial intelligence. So with this, I am really concerned that I really think that, do we have a choice? Can we ignore the artificial intelligence, and do we need to work on that? Do we need to explore further how we can help our students? Because our student is adopting it. They are using ChatGPT. They are using online systems who are working for them. So they are using it. And if we will not make a right intervention, it can harm them badly. Like at the end, they would be having the degree, but maybe they would not have those skills that are very necessary for them. So it is a real call. I think it is a real call for us to work on that. Then the leading question is, are we ready to embrace AI? And with this, I think if we work on that, like, are we ready to embrace, to be ready, or to comment on that, we are ready or not, what to do with, to make an informed decision. I think the areas we need to consider: well-designed curriculum. So what our curriculum is, if it is facilitating the rote learning, and artificial intelligence is there to help the student to have all the information, all knowledge they will bring in. So what will our curriculum should have? What our curriculum should have, and that can be facilitated with the by incorporating AI in the curriculum, how it can work. So what could be the right instructional design for us, and to prepare our future professionals to perform their role more efficiently. And then reliable education and training. So it needs that, it requires that we need to understand it, how we can help our students, what should be the reliable education and training. So it is not reliable that, would it be reliable that our student go to the online softwares and prepare an essay for us, or make preparation of the exam? Or so would it be reliable? What skills he need to learn actually, and what he is missing when he is working with artificial intelligence? Then the appropriate assessment and learning outcomes. Our education, or the basic curriculum, it functions on the cognitive, psychomotor, and affective domains. And if we talk about cognitive domains, it has levels C1, C2, C3, C4, C5. So what levels machine is covering, and what levels we need to emphasize? So how the cognitive levels, how the cognitive domain can be shared? So these are some questions, and I think we don't have the educators around the world, they don't have the answer, but they are trying to look out the answers to these questions, to make an informed decision that do not harm our students, but it help to prepare very competent future professionals. And if when we talk about the students, the educators are there. So what would be the role of educators in the age of AI, if we are using ITS system to facilitate learning of our students? So what communication a teacher can do? Might be we can give the counseling role or the motivation role to the student. But again, I'm not clear that we don't have the right answer to it. How the mentoring of the students would be done, which facilitation teacher can provide to their students, which type of counseling students would need, and how the evaluators will evaluate their students. So how the stewardship and advocacy role would be played. So to make the teachers, how the competencies will be transformed in the artificial intelligence, in the age of artificial intelligence. So these are the real areas I think we need. These are the future calls for the research, and to make an informed decision. And if we go further, there comes what could be the implications of artificial intelligence. So in implications, there could be the advantages and disadvantages. So if we adopt artificial intelligence in our health professions education, so how it will benefit and how it will be challenging for us. So we cannot ignore the opportunities we have with the artificial intelligence. And the first of all, the literature says it helps in knowledge management rather than information management. If we see in our curriculum, our students always used to say that there is lot to learn. There's a lot to learn. So, and if we see in our table of specification or in our course grades, there are mostly the C1 or C2 level objectives are there. It means that we are expecting our students to recall the information. They need to learn and recall the information. And there are less work on C4, C5, like analysis and application level. We used to like there are less objectives on this level. So with the AI, with the help of AI, we can manage our curriculum. We can reduce the content. We can identify the important areas that our students need to learn. And with the help of AI, we can better manage the information management, the knowledge, and we can enhance the skills of the students, or maybe the affective and the psychomotor skills that are more required to become competent. But again, the question is, if we will focus on the application level and the psychomotor and cognitive affective domain, it has the foundation on cognitive level. So we cannot completely ignore the cognitive level. So how we can adjust our curriculum in a way that we do not ignore or left unturned the important stones, and then improve learning experience. AI provides the opportunity to improve the learning experience of the students. Means like if we develop the system that with our virtual reality system or this online system, it has provided us the opportunity to be comfortable. Like today is the Sunday and you all are sitting in your home with comfortable environment, and we are being facilitated with an educational opportunity. So this has improved our experience. It has improved our learning experience. Although I have to move from my home to the institute because of my internet connectivity, but it has still improved our learning experience, and it can help the students as well. So enhanced student engagement. Some students, they are visual learners, some are rote learners. So some used to learn with music and some got distracted with that. So you see, every student is different, and a single teacher cannot fulfill the expectations of every student, but the artificial system can. It can generate individualized learning opportunity for students. So it can enhance the students' engagement, and then it can overcome passive knowledge transfer. And I can remember when I was a student, and I only used to remember few words from my lecture of 1 hour. And it seems that it was a passive learning and not the active learning. So the AI provides the opportunity to overcome this area and enhance the interaction of the students. But again, the question comes, the student is interacting with machine. So we are not preparing machines. We intend to prepare the human who has a kind heart, who has the aesthetic sense, who is emotionally intelligent, who can regulate his own emotions and others as well. So would the machines be able to do that? So similarly, there could be hundreds of questions, but with all these questions, the world is moving towards AI. So would we like to stay behind, or we would like to come in streamline? So it's our choice. And if our students, future students, they are supposed to work with the machines. So I think it's our responsibility to foresee the future, to pave the way for them, to facilitate them and provide the environment where they can flourish and nourish. And with the opportunities, the challenges are there. And the most discussed challenges are the ethical concern, because artificial intelligence tools, they are using data. And it is an ethical concern that it will destroy the privacy, individual privacy of the student or us, because data is being used for the further improvement of the system. So, and if we use artificial intelligence, the plagiarism is a big concern that can come. So what idea the student has generated and what idea has came from the machine. So it will be a challenge for the teachers or the educators to rule out the plagiarism in the education. And then job insecurity. The job insecurity is there. All the companies who are adopting artificial intelligence system, it is replacing, like a system can work for that was previously done by 10 persons. Now a system can work efficiently and handle all the expertise that those 10 people were adding in. So it is replacing the humans, and the employers, they want efficiency, they want cost effectiveness. So it is more easier for them to replace the humans. So job insecurity would be there, and educators training. If we say that artificial intelligence, we are going to talk about that, we are going to work on that. So we need to educate our trainers. And I can remember the difficulty we faced when we trained our people about the online learning. So it was difficult for us, and especially when the softwares are paid versions. So we need to purchase the softwares. So educators training would be a concern for us, and it is for the world also. And lack of research funding. And if I am talking that we need to research on, we need to find out what it is actually, how it happens, and how it would work. So we need research. And again, for research funding, it would be a challenge for us living in a developing country, in a resource constrained country. So it would be a challenge for us. And it is if we adopt artificial intelligence and if we give room to the AI in our education, definitely we will have to work on curriculum revision. So curriculum revision is not an easy task, and it will be a challenge. So with all these challenges, we are committed to provide excellence in our education. We need to develop future professionals who are competent enough to work with machines and provide the best care to their patients. So this is our challenge. So, and the other challenge is every human is different. And if every human is different, how a machine would machine provide all the facilitation? We are saying that yes, machine can develop individualized learning outcomes, but how it can deal with humans, or every human is different. So it is again a challenge. And in the end, there are big questions like, can the curriculum be shared? Can we rely on machines? Can we give cognitive or rote learning or the knowledge to our machines? So would it be effective? How it will transform our healthcare system? So how it can help and how it can transform? These are the questions, and they need answers. And the educators can really work on that. we can just simply cannot say that artificial intelligence is coming here to destroy the world. Our our students will be nowhere. They would not be able to work enough. They would not be competent to diagnose, because they will heavily rely on machines. So we cannot only believe or work with our assumptions, but we need the evidence to make the informed decision. So these are the areas and where we need to work on, and we need to give our input.
Excellent.
So I will conclude with the Stephen Hawking's quote that artificial intelligence is likely to be either the best or the worst thing to happen to humanity. It is our responsibility to find out the right way and facilitate our students and make an informed decision. With this, I will say thank you very much. And
thank you very much, Miss Madam. Excellent talk, and really कहते हैं है दिल के लिए मौत मशीनों की हुकूमत एहसास मुरव्वत को कुचल देते हैं हालात, no doubt. It is the need of the things, need of the way that we have to do. Okay, Professor Tariq, you have raised the hand.
Assalamu alaikum.
Tariq Mufti.
Assalamu alaikum, Tariq Mufti. Yes.
Yes, sir.
Walaikum assalam, sir.
Well, I don't know many of the people around participant, but I want to introduce myself that I have been an old timer, but connected with the health professional education. My first of all is a great congratulations to Madam Salma Kundi and all the other organizers to have given us the opportunity on this upcoming area, which is an unfounded area for us. And I agree with that. I won't take long. I just want to put in this submission that like many of the generations of the tutors and teachers we have seen in my life. Sorry, can you hear me?
Okay,
can
yes,
you hear me?
Yes, Chief.
All right. So like many generations that I've gone through of the training from the manual to the computer to the internet and now to the artificial intelligence. My question is that many of us, even not yet acquainted with the manual system, what to talk of computer and what to talk of the AI ultimately. My big submission is that whatever we do, first of all, we take care of our tutors, we make them understand, we give them the facility and good training to the tutors before actually reforming curriculum or any other area which we are concerned with. Thank you.
Can I make a comment?
Okay, before making the comment, can I request Ms. Hira to answer this question of Professor Dr. Tariq Mufti, sir?
Thank you so much, sir. I think sir is so senior and he's has a big experience, and he's very right. And I agree with that. And I think I would not be able to answer the questions, but we can take all these questions for the future work. And this is the purpose of this talk, that we identify the potential areas to work on. So thank you very much. I am noting down all the comments and questions, and definitely we will work on that. And I hope we all can work on that. Thank you so much.
So just a small comment,
Yes, Dr. Hira and Dr. Mufti has opened so many things to be discussed in the future. And hopefully on this platform, we'll be able to next time to reply all these questions. Because no doubt.
Can I make a comment?
Okay, Ji Mufti Sahab.
No, I'm Professor Majid Chaudhry.
Okay, Ji Dr. Naveed Jafri Sahab.
Professor Majid Chaudhry.
Ji Majid Jafri Sahab. Majid Chaudhry, sir. Oh, sorry, sir. LMDC likha hua hai. Majid Chaudhry Sahab, you are the teacher.
Assalamu alaikum, Dr. Sahab, kya hal hai?
Assalamu alaikum, madam. How are you? A wonderful talk. A wonderful talk, and you know, I'm sure that's the future. And I think all the faculties need to be trained at the institution level. I have been doing and training my faculty for the last 4 years on artificial intelligence. And I think there is no escape from it. And, we all teachers and the institutional heads need to ponder over. Thank you very much for arranging such a wonderful lecture. Well done.
Can I just, sorry, can I just
intrude
and just place one comment? This
ये
is Professor
टॉपिक जो है
Nushi.
देखें हमने नर्सिंग लेवल पे ले आए हैं देखें इसको हम नो डाउट वी कैन नॉट omit these things we cannot ignore the need of the artificial intelligence and Dr. Samina Malik, professor of physiology UCMD, the last few days you conducted a very successful conference there, first international conference of basic medical sciences. Dr. Samina.
Assalamu alaikum, sir. Thank you so much, Professor Mulazim and Professor Salma, for doing this good work. And I'm so proud of this young PhD fellow, Dr. Hira, Dr. to be, for taking up this important topic in nursing healthcare. So I have just one comment actually regarding the confusion in the minds of many people, because I'm also doing a course on artificial intelligence, and I'm trying to understand the subject, and I'm making use of it in writing review papers, meta-analysis type papers, because it is, if you are able to make artificial intelligence a slave, then you can be the king. So the important thing is that the faculty should not get disturbed that there is some foreign body, some alien, some robot who is going to replace you. No, it is not going to happen unless you equip yourself, as Professor Majid Chaudhary, he just mentioned, that we need to equip our faculty with this skill so that we can save time. And it's not that it is without references. Yes, ChatGPT is without references, but if you use it with the scientific tools of AI, like those that are used in the literature survey, including Elicit, Research Rabbit, to name only two, with the help of Semantic Scholar, from where it derives its data, all the artificial intelligence tools, then you are able to get hold of the summaries of the top papers. And this will save your time in writing the reviews instead of exploring them on PubMed or other research engines like Google Scholar, and then reading the whole paper and then understanding the summary. So this is the beauty of artificial intelligence, that it is your slave and you should better enslave it and use it so that you remain the king. And regarding the teaching and learning, sir, regarding teaching and learning, जो Dr. Hira फरमा रही थी, कि जो है हम उसको use कर सकते हैं in understanding tough topics, और ये कि core क्या है, crux of the matter क्या है, बिल्कुल कर सकते हैं, but by dialing the right or pressing the right button, तो जिसके अंदर जो है reference जो है वो मौजूद होना चाहिए. दूसरी बात ये कि the students, they tend to misusing their own mind. ऐसा नहीं होना चाहिए कि हम अशरफुल मखलूकात थे, हमें अशरफुल मखलूकात रहना होगा, और उसके लिए ज़रूरी है कि हम अपने दिमाग को इस्तेमाल करना ना बंद कर दें. When a teacher asks a question these days in the classroom, तो स्टूडेंट्स की टेंडेंसी क्या होती है, वो गूगल का बटन दबा के उससे पूछ लेते हैं, वो अपने दिमाग से पूछना भूल गए हैं. तो हमें ये नहीं था करना. हमें सबसे पहले वो सवाल अपने आप से पूछना है, उसके बाद उसको डिस्कशन ओपन करनी है, उसके बाद हमें सारे टूल्स यूज करने हैं, चाहे वो AI टूल्स हों, टेक्स्ट बुक्स हों, लिटरेचर सर्वे किसी भी तरीके से हो सकता है, कंप्यूटर बेस्ड, AI बेस्ड, और फिर हमें उसका जवाब ढूंढना है और लॉजिक तलाश करना है. सो ये अगर क्लासरूम में स्टूडेंट्स को हम ट्रेन करेंगे कि दे हैव टू कैरी अ नोट पैड इन देयर हैंड, जिसके ऊपर उन्होंने ये नहीं लिखना कि जो स्क्रीन पे लिखा है वो उठ के उनके लेक्चर नोट्स में आ जाए बगैर प्रोसेसिंग इन द माइंड, बल्कि होना ये चाहिए कि टीचर जो बोल रहा है और जो डिस्कशन हो रही है वो उसका एक नक्शा बना रहे हैं जिसको कॉन्सेप्ट मैप कहते हैं, बॉक्स एंड एरो डायग्राम, और वो अंडरस्टैंड करे कि क्या बात हो रही है और बीच में उस एरोस के क्या है और बीच में कौन से मैकेनिज्म्स हैं, और फिर अपने गैप्स को आइडेंटिफाई करे और क्वेश्चन करे ड्यूरिंग द क्लासरूम और चैलेंज करे अपने कॉन्सेप्ट्स को, होने दे चैलेंज. So this is important in the classroom. There should be 3 levels of interaction with the text, with among the students and with the teacher. So this is my 2 pence. Thank you.
जैसे हमने पिछले दिनों कॉन्फ्रेंस की तो उसमें सबसे
जी मुलाजिम सर,
टीचर्स मस्ट बी ट्रेन्ड फॉर दिस. जी डॉक्टर सलमा कुंदी जी, यू हैव रेज्ड द क्वेश्चन.
हाँ जी, मेरा पहले तो मैं नौशीन यूसुफ साहब मेरे बाद आपसे क्वेश्चन करना चाहेंगी. शी इज नॉट गेटिंग थ्रू टू अस. वो रेज हैंड का ऑप्शन उनके पास नहीं है. मैं सिर्फ यहाँ पे ये बोलना चाह रही हूँ दैट डॉक्टर मजीद चौधरी इज वेरी मच हियर.
का माइक ऑन कर देता हूँ.
हाँ, Dr. Majid Chaudhary is here and he was the one who told me during the Corona era कि हम online पे जा रहे हैं. He gave me that idea. And ours Women Medical College was the first college in the medical college sector where we started online. We started teaching students on Microsoft Teams. And then I think we were followed by RMI. So I'm really grateful to Majid Chaudhary Saab for that idea. Now there are big brains sitting here. One of them is Dr. Tariq Mufti, there's Majid Chaudhary here, there's Dr. Umar here, there is yourself here, Dr. Mulazim Saab, Samina is here. Let's sit down and chalk a syllabus for our students and for our staff, how we train them on artificial intelligence so that we are the masters and artificial intelligence is subservient to us and to our students.
Can I make a comment, Dr. Salma?
Ji. Pardon me?
Can I make a comment?
Ji, sir.
Okay.
Okay, sir.
Right. I think I gave a suggestion to the government of Punjab about in 2008 that we should have a medical staff college and we should train our faculty, assistant, associate, as well as professors. And I think artificial intelligence is one which I have been doing it for the last 5 years. Would you believe by a professor from Nepal, Professor Sunil Sharma, who is kind of a forerunner in this field. And I think this medical staff college concept is being taken up by University of Health Sciences. And so I think from that platform, all institutions can train their faculty. I think we have experts available up and down the country to help our faculties out. And I agree with Tariq Mufti Saab that our senior faculty don't have even know-how of computers, unfortunately. But I think we have to adopt it, and that's the future. Thank you.
Thank you, Professor Majid Chaudhary Saab. Actually, basic thing is to train our teachers so that if the teachers are trained on this artificial intelligence, machine intelligence, deep learnings, they can easily train and teach the students. Definitely, we will discuss this thing, your point in PMDC, and we will raise the agenda to the PMDC. Inshallah, we will also put this suggestion to our next meetings and also in the health task force of the Pakistan. Madam Nosheen, you want to ask the question? You can.
Yes,
Madam.
Thank you very much.
First of all, welcome Professor Nosheen Yusuf, teachers of the teacher, even my teachers, Professor Nosheen Yusuf.
Okay, thank you. First of all, my absolute appreciation for Dr. Hira, because she made a very complicated and difficult topic very easy and simple, especially for the beginners. So that was really commendable. Just one apprehension on my part that artificial intelligence is now sort of becoming a norm, especially at school level. The kids of class 9, 10, 11, 12, especially in IB system or OA levels, they are regularly using AI. And then coming to professional colleges, maybe its use is a little bit less compared to schools, let me tell you. My apprehension is that students find it so easy and a shortcut to gain knowledge. So the like with calculators, the mathematical mind and the mental calculation era has gone. Uh, this artificial intelligence, when it goes to the desk of a student, it is so easy to get the knowledge that they are somehow trying to get rid of exploring knowledge through books and their own syllabus. So I would like to have the comment of the experts on how to combat this, because if you feel that we will tell the student don't use it to an extent, don't go beyond limits, that is out of question, because any shortcut is always acceptable to the students and they welcome it. Then just one suggestion, that for professional level medical colleges, etc., since we are dealing with that at the moment, we must hold regular workshops in every medical college, every medical institution at every level, so that our faculty becomes familiar with artificial intelligence before we impart it to the students. So regular workshops is the only answer, which should be mandatory, like CPSP has certain workshops mandatory for its fellows. So this AI workshop should be mandatory for our faculty as well to become fully accustomed with it. Thank you very much, Dr. Mulazim.
Thank you, Professor Nashina. Very good suggestions for conducting the workshops at each and every medical institute to teach the faculty development. Professor Tariq Mufti Sahab, you raised the hand.
Yes, sir. This is great that people are taking part in this discussion and very fruitfully. I would go to the crux of the matter. अगर आप ये देखें कि research जैसी बेसिक चीज आज तक रेगुलेटर जो है तो हमारे करिकुलम में नहीं ला सके, और इसी तरह even medical education, health professional education in real sense has not been part of this system. तो उसका रीजन एक ही है, वो मैं शॉर्ट में बताना चाहता हूँ कि देयर आर बहुत सारे लोग होते हैं, न कारखाना होता है उसमें तूती की कोई नहीं सुनता, बहुत सारे लोग, मजीद चौधरी साहब जैसे मेरे बड़े करीबी दोस्त हैं, आई नो हिज टैलेंट एंड हिज मेंटोरशिप, लेकिन क्वेश्चन इज कि वी हैव टू वर्क प्राइवेटली in such a way जिस तरह के हमने प्रोफेशन के लिए मॉड्यूलर सिस्टम इंटीग्रेशन की कोशिश की, इसी तरह मुझे ये लगता है कि मैडम ने जो कुछ कहा कि जो लोग समझते हैं या थोड़े बहुत उनका दस्तरस है वो आपस में मिलकर बैठें, और somebody should make an arrangement for us कि जी ऑनलाइन भी ठीक है लेकिन इन पर्सन भी कभी कभी ठीक होता है, उसमें जरा ज्यादा आसानी से हम बोल सकते हैं, तो उसमें बैठकर बेस लाइन तलाश करें जो कि हम रेगुलेटर को पेश कर सकें. थैंक यू.
डेफिनेटली मुफ्ती साहब, आपकी बात पे मुझे ना एक शेर याद आया है, हम मोहब्बत के खराबों के मकीन, पाकिस्तान की खास तौर पे, हम मोहब्बत के खराबों के मकीन, रेगे दे रोज में ख्वाबों के शजर बोते रहे, साया ना पाए था साये की तमन्ना के तले सोते रहे. Anyhow, we have to wake up now to.
वाह, थैंक यू.
सर ऐसा है कि हम रेत में पौधे बोते रहे और साये की तमन्ना में हम सोते रहे. इंशाल्लाह ये will do it definitely. Teachers are there. In my medical college, Muzaffarabad, I have started these workshops, and in a women medical college. And last week, there was a international conference on basic medical sciences. Professor Samina is there. We gave this idea, not only the artificial intelligence, and you will be happy to hear that now the ethics and the research has been made the part of curriculum that will be in a longitudinal modules, and they will start. We have started from the first year now in the new curriculum, integrated curriculum. Hope inshallah will be continue the session. The time is too much, and I will request Professor Salma Kundi to conclude today's session. Thank you very much, Tariq Sahab. Thank you very much, Dr. Samina. Thank you very much, Majid Chaudhry. Thank you very much, Professor Nashina. Today's session is the session of the teachers, and also thank you very much today's Miss Hira Ijaz. Madam Salma Kundi.
Thank you, Ji. Thank you, Mulazim Sahab. Thank you so much, Dr. Hira Ijaz. It was wonderful listening to you, and it has opened so many doors into our brains. What I
Yes.
think is that UHS is ahead of us. Maybe they make this curriculum. But we over here from other medical colleges and from KPK, we really need the big brains which are present here at the moment. Some of you are deans and some of you are vice chancellors of universities. Please, let's join hands and make a proper curriculum and impart this knowledge through our IT department to the faculty and to our students. That is need of the day. And we can join hands individually and then float this idea into the PMC and into our different respective universities. Thank you, Hira, because that was a very, very fruitful subject, and it is call and the need of the day. And I thank everyone who's been present here on behalf of the Pakistan Medical Association. My brothers, Kaisar Sajjad Saab and Qazi Wasit Saab are present here at the moment. I thank all of you on behalf of them. And my thanks especially to Mulazim Saab, who takes out his time every week in helping us organize such fruitful seminars. All of you have a very good day. Pakistan Zindabad. Thank you.
Thank you very much, madam.
Allah
Thank you very
Hafiz.
much
Thank
for-
you.
Allah
Allah
Hafiz.
Hafiz.
We'll not meet next Sunday because it's the Eid. अगली ईद के बाद मिलेंगे. Dr. Hira Ejaz, you have opened the door of this discussion, and we will try our best to bring so many workshops, speakers on this platform. I will request one of the person in the USA to conduct the workshops on the webinar next time, inshallah, on the artificial.
That would be great. Thank you, Mulazim Saab.
Thank you very much. See you next time. Pakistan Salamat Rahe.
Thank you.
Ameen.
GD forensic specialist. Thank you so much.
Thank you, sir.
Thank you so much, sir. And it's a great pleasure. I really enjoyed the discussion. It was very healthy and fruitful and thought-provoking. Thank you so much. Looking forward
Thank you, madam.
to
Thank you,
see
madam.
you then. Thank you. Take care. Allah Hafiz.
Thank you.
Allah Hafiz. Allah Hafiz. Allah Hafiz.